And we are recording, and we're going to go ahead and get started. Welcome everyone to the Mental Health in the Remote Classroom During COVID-19 webinar, sponsored by Maryland Online. I am Wendy Gilbert, Executive Director of Maryland Online, and I am not going to put my camera on today. We have a large group today, so I would ask that you all please mute yourselves and put your questions in the chat box. Our presenters are great about answering questions in the chat box. The presenters have also agreed to share their slides, and we will be sharing a link to the recording of today's session. You'll be added to the mailing list for upcoming events from Maryland Online, but if you prefer not to be on the list, just let Kathleen know or let me know. Kathleen is the one who should have sent you the information to log in. Our speakers today are awesome. This is the third time they've presented for us, and I am especially grateful to them for taking on such an important and timely topic and doing it for us right at this time. Stephanie Will is a licensed clinical professional counselor in the state of Maryland and has been training Montgomery College faculty and staff in student mental health concerns and mental health first aid for 5 years. Emily Rosado is in her 12th year as an English faculty at Montgomery College and also serves on the board of EveryMind, which is a local nonprofit that promotes mental wellness. So Stephanie and Emily, I turn it over to you.
Thanks so much, Wendy.
Thank you, Wendy. Good morning, everyone. Thank you so much for joining us.
Hello.
Hello.
Hello. This is Cynthia Bausch.
Oh, hi. Okay, if everybody can mute themselves, we're going to go ahead and get started.
Okay, so again, like I said, like Wendy said, my name is Stephanie Will. I'm a licensed clinical professional counselor, and I'm the mental health services program manager over at Montgomery College. I work with our Student Health and Wellness Center, and in addition to doing mental health training, I do lots of other fun programming. Like I was just telling Emily and Wendy, at 12 noon, I've got to jump because we do a mindfulness meditation every day at noon. So we're trying to really help our students during this time by continuing as much online mental health programming as we can to make sure we're, trying to help keep stress levels down for sure.
Thanks, Stephanie, and good morning again, everyone. I'm Emily Rosado, and I'm an English professor at Montgomery College, and I'm also certified in mental health first aid, which is a really wonderful international program that is offered all over the world. And Stephanie actually teaches it at Montgomery College. And it's a great way to learn how to handle and react to students in crisis. I'm also on the board of EveryMind, which actually staffs the local crisis text line, which is really important and has seen a huge jump in calls over the past few weeks. And I'm also a doctoral student, and my research involves researching education and trauma. So thanks again for being with us. We really want to extend our appreciation. We know that it's a really difficult time right now and everyone is likely really exhausted. We just want to acknowledge that, yes, all of our students are living through trauma right now, but also all of you are as well. So thank you for, just for taking an hour out of your day to be with us and to try to help your students. So we'll go ahead and start with our objectives. And our first objective for today is to identify the term mental health disorder. We want to be careful not to pathologize our students, especially since as instructors, most of us are not trained mental health professionals. So we're going to start with some more general, broad information about mental health and mental health disorders. And then we will kind of narrow down and focus our presentation on recognizing signs in an online setting, defining ways to help students who are struggling, campus resources for students. So as educators, we often talk about student success. Of course, we want our students to pass their classes and to gain skills and knowledge and be able to transfer those skills. But a key and critical factor of student success is the ability for them to strengthen their resilience. And I'd like to ask all of you a question and ask you if your perspective of what success is has changed in the past, 5 or 6 weeks. If you could go ahead and type in the chat, I would really be interested in hearing from you, and just wondering whether or not you've thought about, shifting your ideas and your priorities about what you feel like would make a student successful at the end of the semester as we come upon the last few weeks. And just to bring a little levity to the situation, I was telling Wendy earlier that in this quarantine life of working from home, I am sitting in my tiny bedroom closet to hide from my middle schooler and my 3 dogs. So I'm sure some of you can relate. Okay, so thank you, Joanna. Having access to technology, that's huge. Absolutely. Living with imperfections. Surviving as healthfully as possible, yes. Hasn't changed much, but their needs have changed, of course, right? Thank you so, you probably hear my dogs right now. Thank you so much. Participation, showing up, absolutely. So thank you for those comments. We'll go ahead and move on to the next slide. I'll pass it back to Stephanie.
Yeah, so yeah, like Emily said, it's really important that we all are on the same page as to what a mental health disorder actually is. And I really love NAMI, the National Alliance on Mental Illnesses definition. It's pretty straightforward, and it's basically a mental illness is a condition that impacts a person's thinking, feeling, or mood and may impact their ability to relate to others and function on a daily basis. So again, those are the big things that we're looking at. Is it impacting relationships? Is it impacting a person's ability to get up, get in the shower, go to work, to be productive at work, and to take care of their family, pets, anything that they need to be responsible for throughout the course of the day. It's also important to understand that everyone's going to have a different kind of experience with their diagnosis. If you've ever looked at the DSM, the Diagnostic and Statistical Manual, what we use to diagnose mental health conditions, you will see a whole list of symptoms for different disorders, and you only need to necessarily have like 5 of them, say, to be diagnosed. So 3 or 4 people might have very different lists of symptoms, so they might have a very different experience. It's also really important to remember that mental health disorders are treatable, that this isn't something that you have a diagnosis of depression and you're depressed all day, every day for the rest of your life. Most mental health disorders are very treatable. And again, like Emily said, it's really important that we're not over-pathologizing, because I don't know if anybody has had this experience where, I like to say when I bought my first car, it's a Kia Forte. This was, oh gosh, I can't believe it's been almost like 7 years now that I've had this car. But, I don't even think I knew what a Kia Forte was before I bought it. But once I got out on the road, I see Kia Fortes everywhere. And while I would love to think that I'm just so cool and so popular that everyone ran out and bought a Kia Forte because I was driving one, I know that's not the case. But the more we become aware of things, the more frequently we're going to see them. So as we talk about symptoms and things like that today, we don't want you going back and thinking every student who's a little bit sleepy has depression. We don't want you to think that every student who's nervous has anxiety, because we all experience these things. We've probably all been experiencing them during the last 6 weeks. Those days where you don't feel like getting off the couch, where you're feeling, upset or sad or lonely, where you're feeling really anxious or nervous about going out to the grocery store even, or wondering, when am I going to find toilet paper again? I still have yet to go to a store where there's toilet paper in the last 6 weeks. So these are things that we normally get anxious about, during this time, we would normally get anxious about. And again, exams are coming up for our students. It's normal for students to feel anxious about an exam. It's actually even a little good for students to feel anxious about an exam. They're probably not going to study if they don't feel anxious at all, right? So we don't want to take every single emotional feeling that anybody has and say it's a mental health disorder. There's also things that developmentally are appropriate at different ages. So that's something else to take into consider. You know, is the student that we're working with in high school, is the student that we're working with, you know, in their 30s or 40s. Working at a community college, we kind of see that huge span, especially with our, you know, dual enrollment students. Our students who are with MCPS as well as Montgomery College. So we want to take all of these things into account as well. So some of the symptoms that we might see from an individual who is suffering with a mental health disorder, I mentioned the sleep. Somebody might be sleeping too much or too little, eating as much the same way, kind of that all or nothing type of a thing, having low or no energy, pulling away from usual activities, things that they used to find fun or exciting just aren't anymore. Unexplained aches and pains is another big one. Just feeling really achy, having a lot of stomach aches, headaches, Advil isn't helping, you know, taking Pepto and that's not helping either. Feeling helpless or hopeless. When we talk about individuals who are experiencing suicidal ideation, hopelessness is actually one of the #1 things that we look for. Does the person see that there is ever going to be change, that things are ever going to get better? If they're not able to see those things, you know, we generally get pretty concerned at that point. Is the person using more substances than usual? Again, confused, forgetful, on edge, angry, upset, worried, scared. Again, we probably don't see this too much in a classroom setting, but you know, maybe your students feel comfortable talking to you, hearing about those disruptions in relationships, having persistent thoughts or memories they can't get out of their head, nightmares. Even if the student is talking about hearing voices, believing things that aren't true. Of course, right now that's really challenging because we have a lot of different information coming from a lot of different sources, and it's hard to know, you know, who we're able to trust at this point in time, because even I've been struggling because the first number of weeks it was, you know, don't wear masks unless you're a medical professional. It increases the risk that you're going to get COVID-19. And now it's like everyone has to wear a mask. And I'm like, okay, what changed? So yeah, so there is some challenge with that, but there are some other things that could be indicative of a student believing things that aren't true. Anyone who talks about harming themselves or somebody else, we need to 100% take them seriously. And again, talking about that inability to perform their daily tasks, they're not able to get their homework done, they're not able to get to an online class setting. If you guys still have live classes, I know some people are posting lectures or working more from textbooks at this point in time. So some of the things that we are seeing specific to COVID-19 at this point in time is an increased fear, anxiety, depression, and even anger. Like I mentioned, things are changing so fast in so many different ways. We're getting so much information from so many different sources. And that's really, really frustrating for students. You know, for a number of weeks, it was, well, what's going to happen to my lab classes if we can't go into, you know, a biology lab? Am I still going to be able to pass? You know, what are my options? I'm supposed to be transferring. And when people aren't getting answers, when they're feeling confused about things, that can lead to some of that anger. Again, a number of students are losing jobs. People are worried about their own health, the health of their family members. You know, a friend of mine, she has a husband who is high risk. So the amount that she has to go through every time she comes and goes from her house, leaving packages out on the front porch. You know, anytime she coughs, she gets really nervous that something happened, that she's sick, and that she might potentially infect her husband. We're also seeing a lot of sleep disturbance. People reporting that they're really tired even though they're sleeping. A lot of people reporting really vivid dreams. And I know personally for me, this has been a big one, and it's something I'm hearing from a lot of people. It doesn't necessarily have to be a nightmare. It doesn't necessarily have to be COVID-19 related, but just whatever people are dreaming about, it tends to be very, very vivid. We're also seeing a lot of decreased motivation. Another professional that I work with was telling me she was doing some reading about some of the other countries that have been on lockdown, and they've said weeks 4 and 5 of their lockdowns, they saw a lot of struggle mental health wise with people, a lot of that decreased motivation. I know, again, personally, I can, share what's been going on with me. Some days I'm sitting there doing yard work and crafting and, practicing an instrument and doing all this stuff. And then maybe for 3 days, I don't do anything besides watch TV. So it really goes back and forth with a lot of people. We're also seeing a lot of Zoom fatigue. We were talking about this just a little bit earlier, how, if we're on Zoom for like 6 hours at a time, like that's frustrating, or the number of meetings that we might be, on. So again, for our students, when they're coming in and out of a lot of classes, group meetings and things like that, that in itself can become challenging. As well as isolation. I'm a, introvert. There's a lot of memes running around out there on the internet saying like, oh yeah, I've been preparing for this my whole life as an introvert. Introverts are struggling too. We are having trouble dealing with all of this, because this is a level of introversion that some of us aren't used to dealing with. And that can lead to a lot of decompensating into mental health disorders. So it's not just necessarily students who've never experienced a mental health disorder who might be struggling for the first time. Students who have mental health disorders who might have been well controlled before this might be sliding back into some of that symptomology. There's also an increased consumption of social media that's leading to that more comparisons and negativity. A lot of negative stuff running around about food. And as somebody who, I'm very passionate about eating disorders, just the number of things I've seen about like, the COVID-15 that people are going to gain, and I need to get my beach body right, that's a lot of negativity that can really start impacting people who are struggling with food. And again, I have a friend who is struggling a lot more than I am. So whenever I talk about, oh, hey, like this is what I did today, she's like, I can't believe how much you're doing. Like, that's so great. And, again, it's that comparison. I don't want her to feel bad because she's not doing what I'm doing, because at this point, we're all just doing what we can, So again, it's important to remember that this is a collective trauma, and this has the potential to impact society as a whole for potentially even generations. We think about 9/11. How did that collective trauma impact our society? What did we see? We saw changes in the way we fly that haven't changed in 20 years at this point. The Great Depression. I don't know if anybody had like parents, grandparents, great-grandparents who lived through the Great Depression, and maybe they saved all their Ziploc baggies or every, reused tin foil, or whatever the case may be, because they were used to having nothing. So they were very conscious about saving and reusing things. So these collective traumas really do impact us in a number of ways. So some of the things that we potentially could see down the road, people continuing to use masks, people who are still avoiding large gatherings. There could be a shift in attitude toward vaccines, toward medicine in general. We can see these continued stockpiling behaviors. I may never be able to find toilet paper again at this rate. But, if there's always this fear that something like this might happen again, that's not going to leave us easily, not just our students, but, us as faculty and staff members as well. So we just need to keep in mind that, what we're talking about today is great, but mental health may look very different moving forward. All right, toss it back to Emily.
Thanks, Stephanie. And it's interesting because, just hearing Stephanie talk about all these symptoms, like I could feel my own anxiety start to rise. So, and I'm mentioning this because if you feel the same, and if you start to feel like you need to take a break from the presentation, just feel free to do that. Go, get a drink of water, or just, walk away for a few minutes. That's fine. We'll be sending a recording of the presentation. So just hang in there. Okay, so in an online setting, we can't see our students. I am used to teaching online, but a lot of instructors have never done that. And how do you kind of translate, what you might see in the classroom when you can't see your students, or if you can only see your students through Zoom, right? Totally different medium. So, so mental health challenges might look like absence, obviously. I know I've had colleagues who have mentioned that, they're losing their students and they don't know how to get them back, right? Late work, students who are just not able to just crank out those assignments because they're just feeling so much stress. A change in pattern of participation. You might have a student who was really diligent about attending class and completing assignments, but maybe all of a sudden they've stopped, or, that could go the other way too. Maybe you've had a student who has not been that active in the course, but then now all of a sudden is emailing you, 7 times a day, or, posting like 10 posts in the discussion board when the requirement is only 3. That could also be a sign of a challenge, that kind of like hypervigilance. My next point, you may have experienced students who are hypervigilant and who are just constantly seeking that validation, and like they need you to validate them, and they're constantly texting or emailing. That's another sign that a student is struggling. Inappropriate posts, and by that I mean a post that might be inappropriate for the assignment. So for example, if you have an assignment where you're asking a student to respond with, maybe a 150-word response to a reading, and they end up posting, this like 3-page long soliloquy, and you can just see that their thought process is becoming unhinged. That might be well, that would be a good time to reach out to that student and to check in with them and to just ask them how they're doing. That connection with your student, with your students, really plays a big part in their success. Next slide. Okay, so how can we help our students? And thank you everyone for your chat comments. Please continue to contribute to the chat. Well, from day one, you can establish your online classroom as a safe space. I think this is so important. Going back to that first slide where I asked you guys about student success and we talked about resilience. It's interesting because I attended a conference about 1.5 years ago, and which was all about resilience and how do we increase resilience among college students specifically. And what was so interesting to me was that the most critical factor in a student being able to increase their resilience is having a meaningful relationship with their instructors. So I think it's critical to make sure that your students know that your classroom is a safe space. So how do we do that? Well, one of the things I started doing is including a strength and diversity statement, which is a statement that I put on my syllabus, and it just reiterates that I see all of the diversity in my classroom as a strength, and I list out all the possible ways that I can think that students are diverse, from religious preferences to sexual, gender identity, ability, disability, everything I could possibly think of. And yes, Christine, I have a document that's going to go out to all of you that has a copy of a bunch of things. So I will definitely share that. Also including a short bio, moving forward, if we're going to be remote for the summer and the fall, including a bio and just presenting yourself as approachable, I think goes a really long way. Also, sending an email to the class before it starts is something that I like to do. I like to welcome the students, tell them that I'm really excited to have them in my course. I also send them any textbook information if I have any. Most of my classes are OER courses, but if I have textbook information, I try to give them that heads up so that they can try to get prepared before that first day of class. Also, I like to highlight the resources on campus. We have so many resources on our campus, from counseling to food pantries and mobile markets, and Stephanie manages our Student Health and Wellness Center, and they are amazing at, providing programs for students to help them de-stress and to be more mindful and to help them be successful. Another thing you can do is include your online students in on-campus events, which obviously we don't have right now, but moving forward, if you have an online class, invite them in and invite them to your online office hours, invite them to, the sporting events or, events that you find interesting on campus. Next slide. Thanks. Okay, so I'm handing it back to Stephanie now.
It would help if I unmuted myself. Okay, sorry. I have 2 cats running around in the house and I'm trying to keep their ambient noise down while Emily is talking. But anyway, so if you start to recognize some of these things that are going on with the students, it's important to be able to respond. We're not asking anybody to be the student's therapist. That's not your role unless somebody on here is an actual therapist at their school. Then hopefully you pretty much know what to do as far as response. But we're just asking you to reach out in a human way. That's it. And if you are, I would always suggest talking face-to-face if possible and not on email for a harder conversation or a more extensive conversation, because with email, tone is so hard to convey. And I'm sure you all know that. We've been using email for forever at this point. But we don't want to come off as confrontational. We want to come off as calm, understanding, empathic to our students. So if we can, sending that email saying, hey, can we meet via Zoom and just chat and talk, about your assignments or whatever is going on with the student that you think they might be struggling with. I know that's not always possible, but if you can, I would say that would be the better way to go. Making sure that you're appearing confident when we're talking to our student. If we don't seem like we know why we're having the conversation, we don't expect you to know all of the resources. Again, there's so many different resources out there, but knowing a couple big ones, like where you're at Montgomery, we have a counseling and advising center. We have the Student Health and Wellness Center. Know some of the big ones that can then help your students from there. Making sure that we're listening non-judgmentally, that we're, that doesn't mean we necessarily approve of everything the student is doing, but we're just listening to what they're saying. We're hearing them to understand what is going on. And we want to then stay positive, stay strengths-based, because if we, approach a student and say, hey, I've noticed that these are all the things that are going wrong, that can be really disheartening for a student. So we want to talk about like, hey, these are some of the really great things that we've seen. This is what we know you're capable of, but I've seen some changes lately. What's up? During this time, it is so important to normalize what the student is experiencing. Normalize what your coworkers are experiencing, what your family is experiencing. There is no right way to feel right now. And again, letting students know that everyone is struggling right now and that we need to be compassionate towards ourselves. I had some students yesterday that were like, well, what do we do? How do we, we feel like we're studying just to pass the test at this point rather than studying to learn. How do we change that? And, I talked a little bit about reframing, but I'm like, honestly, we're in survival mode right now. And sometimes that's the best we can do. So normalizing that experience that we're just trying to get through this right now. Again, expressing concern, giving students options when possible. Again, I know at Montgomery, we have still some incomplete and withdrawal due to crisis options for students. So giving them a choice can be really empowering. Some of the things we don't want to do, not using sarcasm. If a student is expressing like delusions or if they're having very strong feelings, don't try to talk them out of that. That's not your job. We just want to be empathic. We want to listen. It doesn't mean we're condoning those things. It doesn't mean we're rubber stamping them, but we are validating that this person is struggling. We don't want to blame, criticize, judge our students. It's really easy to look at some of those symptoms we talked about earlier and give them kind of negative attributes and say, well, oh, the student's lazy. Oh, the student doesn't care. But really the case might be that the student is struggling to get out of bed, struggling to make it to their class. So we want to be, again, not give everybody a blanket statement to do whatever you want, but we need to keep in mind what's going on right now. And we don't want to minimize the difficult situation. We recognize that some of us are very lucky to still have jobs and to still be working, but you know, Emily and Wendy and I were speaking earlier, and I feel like I'm busier now than I ever was, you know, being on campus. And yeah, it's great that I have a job and I'm very grateful for that, but I'm still struggling with working all the time and disconnecting from my job and having that me time at certain times. So we don't want to minimize those situations that people are dealing with. We also don't want to promise confidentiality, you know, because there are some things that we might need to report to our behavioral intervention or care teams on campus. We might need to be making referrals. And if there is a crisis situation, since we aren't able to walk students over to whatever counseling or health center that we might have on campus, we might end up having to, you know, call our behavioral intervention teams. We might end up having to call 911 to do a welfare check on our students. So we want to make sure that we're not telling students, oh, I promise I'm not going to tell you, I'm not going to tell anybody what you talked to me about. And I'll turn it back over to Emily.
Thank you. All right. So thanks, Stephanie. I do think that's really important. What she was saying about just normalizing this and just listening to students without judgment. I think sometimes we can fall into this way of thinking where, you know, if a student comes to us and they're like, well, you know, I'm so tired because I'm working double shifts. You know, the last thing we want to do is say like, well, at least you have a job. You know, like we want to, we want to be really supportive and just and understanding, that compassion goes such a long way. So what are some, you know, what are some things you can do now? And I personally feel it's not too late to amend your syllabus, even though we just have a few weeks left. But we can be firm but flexible with our students. That is definitely needed. Like David said in the chat, you can't divorce the social emotional aspects from our students, from their learning. They go hand in hand. Another way that we can be supportive is by using principles of universal design. You know, clear navigation in the course site, very clear and consistent instructions, making sure that your materials are accessible. This is where your campus's DSS office could really help you. You know, if you're posting videos, you know, are they accompanied by transcripts, right? For those students who might not be able to hear the video, excuse me. So the DSS office could be a really good source of information. Also, your campus instructional designers are likely well-versed in how to help design your course so that it's more accessible. Make sure due dates and deadlines are clear, but offer some flexibility. So obviously it would be really difficult to just say, hey, whenever you want to turn this in, I'm good, right? I mean, we need to have some kind of structure, and students need that structure too, but you can always be flexible with students. I tell my students, as long as they approach me ahead of time and just give me a heads up that they're struggling, I will help them. And of course, you can have an extra day or 2 or 3 days or whatever you need, right? I mean, many colleges right now are using, you know, either pass-fail grades, or, you know, at the college we're having like a new option of withdrawal in crisis or incomplete in crisis, right? So we're doing our best to help get those students through the course. Offering multiple attempts for high stakes graded assignments. This is something that I've changed just in the past few weeks. For those, you know, I teach English, so for those longer essays that are worth, you know, 20% of their overall average, I'm allowing them to rewrite. If they can rewrite, you know, and with my guidance and show that they can meet those standards, then absolutely, why not? I mean, it does take a little bit more time for us, but again, you know, it seems really unfair to me if a student, you know, ends up failing a class or getting a really bad grade because, you know, they just couldn't pull it off because of all the duress that they're under. Next slide, please. Okay, so what are some other things that we can do right now? Some of the things that I've done. We can increase the number of low stakes assignments. So I've actually I got rid of one of my favorite assignments, which is a longer, bigger assignment, and decided to go with some smaller, shorter assignments that still meet those standards, but that are less overwhelming to the students. So increasing the number of low stakes assignments, offering alternative assignments, the diversity statement, which again, I will send to all of you. Keeping an open line of communication with your students, I think is so, so important. I use EveryMind personally. There are other text services that you can use where you can still retain your privacy and not give out your phone number, but still communicate with students by text. Again, going back to that resilience piece and, helping students succeed, they need that relationship with us. They need to be able to reach out to us, and they do reach out to us. And one thing that I wanted to just mention quickly is that, of course, we need to set boundaries for that, right? I have colleagues who struggle with, students texting them day and night and on the weekends, and that's really hard. And we also have to take care of our own mental health. And that's a whole other webinar. But I just wanted to mention that you can set boundaries. You can add an addendum to your syllabus and say, these are the hours where I will respond to texts. So Monday through Friday from 9 to 6. And if you text me after that, you will not get a response until the next day. So that has worked really, really well for me. I do occasionally get texts on the weekends, but they know that I'm not going to answer until Monday. Offer a late work freebie. I think I've offered like countless late work freebies in the past few weeks. Just, allowing the student to know that you're on their side, showing them that you're on their side can really, really help motivate a student who might be like just on the edge of just, trying to figure out, do I drop this class? I can't do this anymore. Or, okay, well, she's letting me, or he's letting me, have an extension. He's letting me turn this in and it won't affect my grade. So maybe I can pass the class. Posting the number to the crisis text line or the suicide hotline. I always give this to my students and I tell them that, you may never need this, but you may have a friend who is in crisis and you might not know how to help them. And here, just take this number, keep it in your phone. And if you ever do need it, at least you have it. And just kind of like giving that information again during midterms, finals, or whenever stress is high, I think is a really good practice. Next slide, please. Some more tips. So what Lauren had just put in the chat, invite students to virtual events. I'm amazed at how many events Stephanie's Shaw Center has put on. We have brain breaks, mindful Mondays, Raptor Fit. We have student forums, like so many things. And I think that's great because students really feel that loss of connection. For many of our students, their, coming to college was their social time. That's where they see their friends. Not only that, but that's also where they access their internet, right? We talked a little bit about accessibility, but it's a huge loss for students to not be able to come on campus. Another thing that I like to do is just email out these printable calendar sheets because so many of my students say that like they have a hard time keeping track of classes, especially now with each instructor handling remote teaching differently. It can be a nightmare. So you can get these templates online and the student can just print it out or just save it to their computer and have a way to physically like write in their due dates and their assignments to help them keep track. Checking in regularly with students who haven't turned in work. I have a couple of students right now in one of my classes who are having a really hard time submitting their work, just getting motivated. They say they just want to sleep all day and it's so hard for them. Their homes are not the most conducive place to do work, right? That's something that we have to think about too. And so I pretty much harass them every few days and I ask them how they're doing and tell them that I am still waiting for their assignments and to let me know if they need help. These are also students who have taken the course before. So this is the second try. And I would hate for these guys to fail again, and have to pay for the class again. So I'm just trying to do whatever I can to help see them through these last few weeks. Engaging on the discussion boards is something that I like to do. Students like it. They like it when we chime in and they even they feel proud when they're like, oh, the professor replied to my post. So, you know, again, just establishing presence, being visible and being supportive is good. Holding online office hours. Stephanie, if you could forward, this goes into my next point about using a scheduling software. So I know some of my colleagues have been doing this for a while, but I just started using a scheduling software called Acuity. And it's great because students can, you give your students a link, they can see your schedule, like what's open, and they can click on a block of time. I have mine in 15-minute increments. So they can click on a block of time on a specific day and sign up for a Zoom meeting or, you know, a GoToMeeting, whatever you use. And then the student gets a copy of the appointment, and then I get a copy of the appointment. And it's been great because I've had students from my fully online classes who I normally don't speak to, right? They're making appointments, and I'm actually getting to hear their voices, and they can hear my voice. So that's been something that I've enjoyed doing over the past few weeks, something new that I haven't done before. Also using video or audio messages to increase your presence. I just started making videos for my students because I felt like when we do have our synchronous classes, which I still try to do every week, I don't want to just lecture them, right? I mean, that's boring for them to listen to me talk for 20 minutes. So I started recording some of that content, putting it on YouTube, and then when we come back and when we meet as a class, we can discuss it. Or, you know, I spend a lot of time asking them how they're doing. Like Jen mentioned in the chat, just saying like, how are you? Let me know what's going on. Like, what's going on in your life? How can I help you? What resources do you need? Let me point you to the right resources at MC that can help you. So those video and, you know, or audio messages I use too for my online classes. If I feel like a lot of them are kind of like slipping away, I might record an audio message, give them a little pep talk and say that, you know, you can do this. I'm here for you, and let's just try to finish strong. You've come so far. Like, you know, let me know how I can support you. Also, someone had mentioned in the chat, thank you very much, about, you know, students might not have technology, right? So what a few of us did at the beginning of this whole, you know, COVID nightmare was send out a survey to our students and ask them, you know, do you have internet access at home? Do you have a tablet or a laptop? Or, you know, yeah, I love Google Forms. I know it's so easy to use. But it's a really good way to quickly kind of get that information so that you could, you know, tailor your approach appropriately according to, you know, what your students have or don't have. Stressing the importance of limiting media exposure. So Stephanie talked about this earlier. It can be hard when you're bombarded with, you know, story after story, and like people are dying and you're seeing like that ticker go up every day. I don't know if you've seen those graphs, but it's like every day the bar gets higher and higher, and like these are like all the people that are dying, and it can be overwhelming. And you know, for our students too, you know, you want to ask them to maybe try to limit their media exposure. Maybe they don't need to get on, you know, Instagram like 10 times a day, or Snapchat, or whatever they use, you know, just to try to like keep a balance. And I actually, I made a video for students about how to stay grounded, you know, during this time of remote teaching. And that's, I have included links to my videos on the handout that you'll receive. So if you want to check those out, they might be helpful to you. Intervene early and often, be intrusive. This is a time where we can absolutely be intrusive and, you know, get in their business and ask them what they need and how we can help them and support them. We don't want to lose our students, right? We want them to finish strong. We want them to build that resiliency, because there are going to be other challenges that they're going to encounter in, you know, their future college careers and their future, you know, jobs. So, intervening early and often now, I think, will help them to kind of like build those resilience muscles, I like to call them. Also, offer opportunities for your students to be of service. The research shows that people who volunteer and do service for others are happier. And also gratitude. I talk to my students a lot about gratitude and how if you can think about a few things every day that you're grateful for, it can actually rewire your brain and help you to feel more balanced and just happier. So I like to talk to them about volunteering, which is tough right now, but there are still some opportunities for students as far as, like giving out food or helping for those kinds of needs for for other people in the community, or for elderly people who aren't able to go out and shop. I just think it's good for students to have a focus and to think about something that's outside of themselves. Next slide. Back to Stephanie.
Sorry, I couldn't figure out how to unmute for a second. My thing wasn't popping up the way it was supposed to. And now this is being, gotta love technology. Sorry guys, I apologize. I will get this back to where we're supposed to be. All right, there we go. And another thing is, again, self-compassion. We all need to be kind to ourselves when things like this happen. We can't always help it. Again, my cats love to stand directly in front of my camera when I'm Zooming with my colleagues or my student workers. So that's always fun. But again, compassion for others, compassion for ourselves, and just figuring it out as we go. Some of the ways that we can help our students, some different places we can refer them, is to have them engage their family or their support system, whoever that is, whether it's family, friends. I personally, again, live alone with my cats. All of my family members are at least an hour away, and for various reasons. My mother works in the medical field. My grandfather's 90. So I can't physically see them, but every week we have family happy hour, and everybody gets on except for my grandfather because he does not like the video chatting things. But we talk. Just this week, I've started having dinner dates with my friends. So we FaceTime while we're eating dinner and chat about whatever. So there's different ways that we can engage those support systems. Encouraging professional help. We're very lucky in the mental health profession. Telehealth is still pretty readily available. So if students have a therapist or a psychiatrist already, most people have been able to continue with those appointments. Again, because of the influx that we're seeing of mental health concerns, that's why hotlines are so important. The crisis text line is so important. They're still there, they're still available. If a student has a spiritual leader that they prefer to talk to, if they don't necessarily feel comfortable talking to a mental health professional, that's fine. We just need to help them engage somebody at this point in time. It's also important that even though we are not physically on campus, we're still letting our campus know what is going on with students. So if your school has a behavioral intervention team or a care team or a counseling and advising center or whatever you all have, make sure you're still utilizing those avenues, so that when we do come back to campus, or again if there does become a crisis situation, you're not dealing with it by yourself and the student isn't dealing with it by themselves. And again, we don't have our public safety at this point to deal with in a life-threatening crisis, so we need to utilize 911 services in our area if a student is talking about feeling suicidal, feeling actively suicidal, and again, engaging those crisis hotlines. And a crisis is whatever a person deems a crisis to be. It doesn't necessarily need to be that a student is feeling suicidal. It could be that a student is just having a really bad day with stuff that's going on and needs support and needs somebody to talk to. Totally appropriate. And I wanted to kind of go back and mention this with what Emily had been saying earlier, because now everything is on like our computers or tablets and everything like that. My students have been very excited about some apps that restrict your internet, because if they're anything like me, you start and you're in your email and then all of a sudden you're, you know, on Facebook and then, you know, all over the place. So there are apps out there such as Stay Focused and App Block that'll help turn off those other apps for a certain period of time while a student is trying to study. So knowing that exams and everything are coming up, that might be helpful for some of our students as well. But again, when we're referring our students, make sure that we're also keeping this stuff in mind for ourselves and our family members, that we're engaging our support systems, that we're doing what we need to do. I know at the Shaw Center at Montgomery, we've really expanded our services and we invite faculty and staff to attend them as well. I think our daily meditations, we've had more faculty and staff members attending than students attending, because we need the break too. And we really need to make sure that we're taking care of ourselves in all of this as well. So keep that in mind as well, that, you know, these resources are there and available for us too. And then here again, NAMI.org, great website. If you want some myths and facts related to mental health. And there's also a really great study for those of you who are community college employees. There is a great study, Too Distressed to Learn, Mental Health Among Community College Students, looking at, you know, mental health among community college students, which isn't something that's studied nearly as much as within the 4-year school. So I'll be interested to see how this data may eventually change post coronavirus. So yeah, that is all we have as far as the presentation. So I don't know, do we have any questions?
Thank you guys so much for sticking with us for this hour. For some reason, it felt like a long hour to me. I don't know if it's because I'm like sitting in my closet and sweating, but thank you so much for hanging in there.
Yeah, I think you guys did such a remarkable job of answering questions as you went along in the chat. We probably don't have a whole bunch to add, but I do want to thank Emily and Stephanie again for another fantastic presentation for our webinar series. And again, you'll find an email from us soon with the recording and all the resources, because they are so generous. And thank you all for taking the time out of your day to learn a little bit more about this important issue. Thanks, everyone.
Thanks so much, guys.
Thank you so much.
Thank you.